Hello everyone, I'm Dr. Karthika from Department of Biomedical Engineering, SNS College of Technology, Coimbatore. In our previous video, we have discussed about medical images obtained with ionizing radiation and three main uses of ionizing radiation, as well as we'll discuss about the three main phases of ionizing radiation while treating the cancer. And next, we are discussing about the role of tracers in treating cancer. There are many uses of ionizing radiation based on the fact that it is easy to detect. In such applications, a radioactive material is used in the form of tracer. In previous video, we have discussed about radioactive form of cobalt-60. In nuclear medicine, a tracer is act as a radioactive substance and which is taken into the body injection or as a drink, and such a substance is normally a gamma emitter which is detected and monitored. Actually, this tracer, it gives the indication of any problems present in body organs or tissues, and also it is used to calculate how much, how little, and based on the substance absorbed we can detect the how much amount of problem arises in body organs also to be calculated. With the help of this substance, we can easily calculate problems in body organs or tissues effectively and easily. See, nuclear medicine tracers, actually it is very important to study internal organs, tissues without the need of surgery. And in such cases, radioactive tracers, it can be injected into the body, and we can easily trace and we can easily study about our internal organs. It has mainly two parts. First one is a drug which is chosen for the particular organ that is being studied. Second one is a radioactive substance which is a gamma emitter. See here, with the help of this radioactive substance, we can easily study about our body organs, as well as we'll do some diagnosis as well as treatment. See, traces used in nuclear medicine. Here I've listed some of the traces used in nuclear medicine. The medical uses are normally brain imaging, acute cardiac infarct imaging, and in this lung ventilation imaging, nuclear medicine plays a main role. And also nuclear medicine and renogram image processing, which is used for treating final stage cancers and the issues which related to internal organs especially. And also it is mainly used for bone scans also, nuclear medicine. See, the factors which affect the choice of tracer. Here, such tracers are chosen so that they'll concentrate in the organ tissue which is to be examined, and they'll lose their radioactivity 1 by 2, short 1 by 2. I'll explain what is 1 by 2. Half, it is called half. They emit gamma rays which will be detected outside the body. See here, we have to choose the gamma rays since alpha and beta particles would have been absorbed by tissues and which is not be detected outside the body. So we use gamma rays, and technetium 99M is most widely used because it has half-life of 6 hours. See, a half-life of 6 hours is a very important thing because a shorter half-life would not allow sufficient measurement of images to be obtained. A longer half-life would increase the amount of radiation the body organs or tissue receive. So half-life of 6 hours is more important. See here, the tracer is injected into the patient. The radiation emitted from a patient is detected using gamma camera. Typically 40 centimeter diameter gamma camera is mainly used. Here, the gamma rays are given off in all directions, but only the ones which travel towards the gamma camera will be detected. See, a gamma camera consists of three main parts: a collimator, a detector, and electronic system. See the electronic system, detector, and a collimator. See a clear picture of gamma camera. See the collimator. A collimator is mainly used for Actually, a collimator is usually made of lead and it contains thousands of tiny holes. Only gamma rays which travel through the holes in the collimator will be detected. This is the main use of collimator. See, second one is detector. Actually, this detector is a scintillation crystal and it is usually made of sodium iodide and with traces of thallium added. The detector is a scintillation crystal and it converts the gamma rays that reach it into light energy. See, the electronic system is placed over here. This electronic system detects the light energy received from the detector and converts it into electric signals. We can easily acquire the electric signals and we can process based on our applications and our needs. See, the diagnosis of static imaging. Here there is a time delay between injecting the tracer and buildup of radiation in the organ. Dynamic imaging. Here the amount of radioactive buildup is measured over time. Actually, dynamic studies are performed on kidneys and heart. See, the renogram are dynamic images of the kidneys and they are performed for the following reasons: to assess individual kidney or bladder function, to detect urinary tract infections, and to detect access to obstructed kidneys, to detect and assess visco ureteric reflex, to assess kidney transplants. See here, performing a renogram, a tracer is injected into the patient, a radioactive material is removed from the bloodstream by the kidneys, and few minutes after the injection, the radiation is concentrated into the kidneys. After 10 to 15 minutes, almost all of the radiation should be in the bladder. The gamma camera takes readings every few seconds for 20 minutes. Here, a computer adds up the radioactive in each kidney and the bladder. See the graph. A time activity curve. See a time activity curve which is produced with the help of renogram to assess the kidneys. See normal renogram, an abnormal renogram. We can easily get a time bound result with the help of this ionizing radiation. And your last part is sterilization. Sterilization is one among the best applications of ionizing radiation. Radiation normally kills cells, it can also kill germs or bacteria. Here nowadays we are using medical instruments. Here gamma ray is used as source to kill germs. In this germs or bacteria, it does not damage any syringe or nor make it as radioactive, but it cleans, it sterilizes our products, our things, our elements. This is the main thing. See, ionizing radiation is used in radiotherapy to treat cancer and to sterilize medical equipment because it destroys cells, and radioactive tracers are used in nuclear medicine because the ionizing radiation it emits is easy to detect. See, the three main uses are treatment, diagnosis and sterilization. Radiotherapy and radioactive tracers are mainly used for diagnosis as well as treating cancers. Here, mainly ionizing radiation is used to sterilize the medical equipment, and whether it has germs or bacteria, it doesn't matter. Ionizing radiation clears all your products, all your components, equipments. Ionizing radiation is a best thing which is used for treating cancer, diagnosing problems of internal organs, as well as it is used for sterilization in medical applications. Thank you.